clinician?
So someone who takes care of people with headache disorders, June is a particularly important month to us. It's a time for us to recognize our patients and their struggles and really to remind them that there is a month to celebrate what they've been going through. Nobody really thinks of migraine as something to celebrate, but personally, I think celebrating the journey they've been on, to take a moment to share with others what they've gone through, how far they might have come, but also to talk to others who they might not realize have a headache disorder, to share that there are people they can see, there's treatments out there for them. They don't have to be alone. This is such an isolating disorder that really being able to hear others' perspectives, especially those that are championing through and are really surviving and coming out feeling better, I think is extremely important. So having an entire month where, as someone who's in the space, tries my best to get out there and talk a lot about it, a lot more than I normally do, and remind people that this is a thing. They are people like me who take care of this thing. It's extremely important, and there's a lot we can do, and there's a lot we spend our time doing to make the future for these patients much brighter, and to encourage our patients to do the same. Get out there, talk to colleagues, talk to friends, talk to neighbors, tell them about, if you're comfortable, what you've been going through, and share with them resources, because this is really the month to do that. So for all of our friends out there who didn't get a chance to attend, or who attended but weren't able to see all the sessions, first, it was our 66th scientific meeting. I think this is super exciting. The field is young, but we're really making moves. We've come a long way. And it's important to realize that we do have virtual streaming. If you're still interested, weren't able to make the meeting, you can go to American Headache Society on the website and actually register to watch the meeting on demand. And I think that is really a great way sometimes to watch information without all of the chaos that surrounds going to live meetings, and to do it at the comfort of your own space. There's a lot going on at these sessions. Even I have to go back and watch things on demand, because I always feel at the science meetings as a clinician, there's things that I'm like, what? Say that like 10 more times so I have a better understanding. Our field has really been moving towards the idea of other outcome measures than just migraine headache days. We know in clinical practice, when a patient comes in to see us, that there's a lot more than just head pain that they're talking about, that there is associated symptoms, but also symptoms they experience in between headache. And so one thing I was really looking forward to during the attending of this meeting was the Saturday sessions, which were talking about the immune system and migraine. And there was an entire session on cognition and migraine. And those sessions did not disappoint. It was really nice to hear about how we are, not we, me, but we, the field, is working on developing some, cognitive screeners to look at how can we really assess cognition in between migraine attacks. But there are measures in place where we can measure cognition changes during a migraine attack. And I think being able to bring that kind of information back to clinical practice is very helpful. When you're seeing patients with migraine, we already know that many of our patients have immune changes that are occurring, that there's a high association with other immune disorders like multiple sclerosis, but also we see a lot of patients who have Raynaud's, rheumatoid arthritis, lupus, and just having discussions on how these associations might exist. And, not much that we can do at this point, but a little bit more understanding about why these things are happening. There was an entire discussion about where our treatments are working. I have really, for a long time, felt that our new CGRP treatments, we're not 100% sure where they work. Many people in the field agree with that. And it was really nice to see how the scientists in the field have been making progress in better understanding that actually some of the medications we were so convinced were working on the peripheral nervous system might actually be working a little bit more in the central nervous system than we thought. So I thought that was really well done discussion. It was a lot of information. I definitely want to go back and try to capture a little bit more on the second view of that. But those kinds of things, again, as a clinician, when you have a patient that comes in and is like, this stuff isn't quite working for me, what do you think is going on? And as a clinician, I say, oh, I think we're just scratching the surface here on understanding this disease and finding new treatment options. It's really amazing when the scientist takes that back from us and goes into the labs and is really trying to figure it out. And now we're able to see that output in these meetings, being like, yep, we're definitely seeing that there's more going on, and these are some of the ways we can start setting some of these new targets. And yeah, it might take some time to find answers, but it's really nice to see that dialogue producing in scientific means, which then brings on more dialogue and leads to new discoveries. So I was really excited by this meeting. Lots of great findings.